Welcome, everyone. My name is Jerry Hajar, and I am the Department Chair in the Department of Civil and Environmental Engineering here at Northeastern University. Thank you for joining us for today's panel discussion. This is the first in a series of panel discussions featuring civil and environmental engineering faculty and members of our Industrial Advisory Board, and discussions around topics relating to civil and environmental engineering solutions addressing the current COVID-19 pandemic. Much of the work we do in our department has been focusing on urban engineering, looking at new solutions for urban regions. And soon after the pandemic started, many of our faculty, about half the department, quickly started addressing some of the most pressing issues facing us in the pandemic, including, for example, developing new testing protocols to detect the virus, testing materials to develop effective masks, addressing the patterns of spreading of the virus, looking at the impact of the pandemic on pollution, and looking at the impact on transportation systems and urban mobility, which in fact is the subject of today's panel. Please see our website at cee.northeastern.edu for more information on our research and education programs. Members of our Industrial Advisory Board have also been addressing issues of the pandemic, and together we're very happy to be presenting these panel discussions. Today's topic is the future of transportation resilience, transportation systems in the age of COVID-19. Before I introduce today's moderator, I would like to mention a couple of logistical details. As a note to everyone, this event is being recorded. Also, we ask that everyone in the audience please keep their mics and video off for better streaming quality. There'll also be a question and answer session after the presentations, and all of your questions can go into the chat, and feel free to add those at any time during the panel discussions. Now I'd like to introduce today's moderator, Christine Kevel, and she'll introduce today's panel. Christine Kevel is a proud alumna of our program, and she's the founder and president and Chief Executive Officer of Kevel Enterprises. Ms. Kevel has been inducted into the National Academy of Construction, the Construction Management Association of America College of Fellows, and the Moles. She's a trustee incorporator at Wentworth Institute of Technology and recently served as Wentworth's commencement speaker. She also holds an honorary doctorate in engineering from Wentworth. Ms. Kevel is chair of the Civil and Environmental Engineering Industrial Advisory Board here at Northeastern. She's the first woman president of the Moles and has received numerous awards, including Northeastern University's Outstanding Civil Engineering Alumna Award. Christine, I'll turn it over to you. Thank you so much for being here.
Thank you, Jerry, and good afternoon, everyone. I'm honored to moderate this virtual panel session on the future of transportation resilience, transportation systems in the age of COVID-19. The world has certainly changed over the past few months, and the impact of the pandemic has drastically affected all facets of life, including transportation. As you are aware, transportation systems are vitally important to the function of a city. The potentially close quarters of public transit, the near-term impact of the stay-at-home advisories on air travel, and the shift in many employees working at home have all provided certain challenges during this COVID-19 pandemic. However, we do see signs of hope because of the fine efforts of our panelists, essential workers, government leaders, and the CDC. Our expert panel, consisting of Northeastern University faculty and government officials, will discuss what transportation may look like in a post-pandemic world. I am pleased to introduce our first prestigious panelist, Sam Simon, PE, CCM, FCMA, and honorary doctorate in engineering. He is a very accomplished Husky, having received 2 degrees from Northeastern, a bachelor's and a master's degree in civil engineering. He is also an active member of Northeastern University's Civil and Environmental Engineering Industrial Advisory Board. Sam is the Director of Capital Programs and Environmental Affairs with the Massachusetts Port Authority. He joined Massport in 1993 and was appointed Director of Capital Programs in 2006. As head of capital programs, Sam is the chief engineer and directs the overall management of Massport's capital investment programs, which include safety, utilities management, in-house design, and environmental permitting and management. Sam is equally busy with his involvement in industry associations. He was inducted into the National Academy of Construction and the Construction Management Association of America College of Fellows. He is past National Chair of CMAA, past Chair of the Operations and Technical Affairs Committee for the Airports Council International, and is a member of the American Society of Civil Engineers. He has been recognized nationally and locally for his leadership. His most notable awards include ENR's Top 25 Newsmakers, Northeastern's Outstanding Engineering Alumni, CMAA's National Person of the Year, and he recently received an honorary Doctor of Engineering degree from Wentworth Institute of Technology for delivering a very inspiring commencement address. Sam's outstanding credentials speak for themselves, and it is indeed my great pleasure to introduce Sam Slyman. Sam?
Thank you, Christine, for this wonderful introduction. And good afternoon, everyone. I think David is going to share some of my slide. David, you're going to share your screens and put the slide up. Let's start the slideshow from the beginning. So next slide, please. So I'm going to talk a little bit about Logan Airport and the pandemic impact on our traffic and our business, and what are we doing on the short term, the long term, and what the expectation are for traffic moving forward. So as you know, on the left-hand side of your screen, you see Logan pre-COVID traffic. We're growing about 2.3% for several years, and then since 2010, we've been growing at a 5% rate. We finished calendar year 2019 at 42.5 million passengers. Keep that number in mind when we talk about future post-COVID numbers as we move forward through the presentation. As you know, in March and through April and May, you can see how the traffic dramatically dropped down to over in April and May, we were down about 98% in passengers. We start to go up a little bit now in July, but the resurgence of the pandemic in the Florida and California and Texas has really dampened that growth and make us a little bit back down on the traffic projection, as we hope that we're going to recover a little bit faster than we are. Next slide. So the passenger is not the only business that was impacted. Obviously, the passengers were down by 96%, like I said, in April and May. But when passengers are down, you don't have long-term parking exits, so no parking revenue. The Ride app used to be 40% of the traffic at the airport. They're down 97%, so we're not collecting any revenue from the Ride app. The Logan Express Rider, the same thing, was down. Taxis is down, rent-a-cars, and short-term parking exit. So we had significant amount of business interruption. Even our concessions in the terminal, we had 141 concession open pre-COVID, and we were down to 21 concession open. But again, you know, there's no passenger to buy anything, so the revenue to the airport and to Massport was cut basically to nothing. Our passenger facility charge, the PFC, this is the $4.50 everybody pays as they leave the airport, also went down to nothing. And if you remember, people have heard me before say that PFC is one of our key revenue generator, because we bond against the PFC. Most of our revenue bond are against the PFC. So if we can't collect PFC, we cannot pay back our bonds. So that's a key issue for us that we need to maintain a close eye on. We also, like I said, revenue from rent-a-cars is down to nothing. So that's a significant amount of revenue that we don't have right now. Next slide. So what did we do? What was our priority really was preserve health, preserve staff, and preserve cash. Health, cash, and jobs basically was our objective as we move through this pandemic. So most of our employees were working from home, except operational staff that runs the airport and the seaport. Capital program, the engineering department, the construction, we maintained our construction going on, so we had to be on site because we cannot do construction remotely. And now we're about 80% back, but most of Massport still working from home. We're abiding by the governor 50% staff requirement. Preserve cash, we obviously, like everybody else, eliminated all salary increases with frozen positions, and we had to reduce our capital program by about $1 billion over the next 5 years, and we'll go through that. And obviously preserve jobs. We are trying very hard not to lay off anybody, but that's also, again, all depend on how the recovery will stay moving. Next slide. So our capital program for fiscal year 20 to fiscal year 24, right before the pandemic in February, we were going to go to the board for $2.9 billion over the 5 years. Very ambitious capital program, one of the biggest capital program of Massport history, the biggest program in Massport history. And then COVID hit, and we had to pivot and go back and look at what is necessary to continue, what we cannot afford anymore. And we dropped the program by $1 billion to $1.9 billion. But beyond that, we also pushed a lot of those $1.9 billion programs beyond the first couple of years of the program, just to see if the recovery is going to be reasonable for us to come back and do those work. So a lot of projects that we had started that you see on the list has been deferred to beyond the 5-year program. Next slide. So as you know, we had several major projects that were already under construction and underway. So we had to maintain those construction projects going and take advantage of the crisis. We did not want to, have a crisis go to waste. So we accelerated some of our work. The runway 927, we were going to do the construction of the runway in August and September and October, and we pulled that very quickly. We started it in May, and we will be done with it first week of August. And the reason we did that, because there's not much operation on the air side, and we were able to close the runway earlier and not impact the operation of the air side traffic. And then we had some 4 to 5 major projects going on at Logan, from Terminal E to the roadways to the canopy and the C2B connector. And we wanted to maintain the construction going. So we worked with the state, and we worked with MassDOT and all our colleagues, and we implemented the Massachusetts COVID-19 guidelines for construction. We also, as part of that guidelines, we decided as Massport, since we have all these 4 or 5 projects going on, is to do a screening of the laborers going to those project sites as a standard screening for all of them. So we took over the screening instead of asking the contractor to do it. So we had one area that employees will come in, we will take their temperature, ask them the questions about have they had a cough, sore throat, and whatever, the 4 or 5 questions, make sure they have a mask on, and then we give them a ticket, just like the one on the right-hand side. It's a two-part ticket. They take both parts, they give one part to their superintendent on the job site, and they keep one on them for continuous audit during the day to make sure that everybody on the job site has gone through the screening. The ticket color change every day, so we can keep everybody honest. So we did that from basically the beginning of the pandemic in March. April 1st, we started it, April through May through June, and we ended around the first week of July, and we gave the screening responsibility back to the contractor because we felt that the risk and the of the pandemic is getting down, and that we are in stage 3 of the reopening at that time. We're still doing a screening for our own Massport employees and capital program. Every person comes into the office has to fill in a survey that makes sure that answers all the questions. Next slide. So this was the screening site that we did at Logan, and people either walk or drive. So we had a drive-through and walk-through of for the screening. Next slide. We also had all the information is all on an app. So every person name was taken ahead of time. So when they showed up, we just asked their last name. We pulled their name. We knew which contractor they're working for. We knew which job site they're working for. And we asked them the question, and then they get the ticket. This app was developed by Luciana and her team. Is a great asset for us, and it was something that really helped us determining how many people per job site showing up every day, and the data was really eye-opener for us, and we used it for business intelligence, basically, because we did not have that data before. Next slide. So what's the impact on construction? So obviously we had some schedule impact from stand down. We had some stand down for all construction for about 3 weeks. Then we had some union actions, and some of the carpenter union did not want to show up on the job even though the jobs were open. Then you got the social distancing, and the social distancing, if you're working in a building and you had 2-3 trades working in a close area, you cannot do that anymore. So you had to be sequencing your work in a little bit different way to be able to complete the work. We had cost impact due to the additional screening, new guidelines, washing station and delays. We had material availability impact to our schedule. So we had a lot of steel coming from Canada, and those steel fabrication was shut down in Canada, so we could not get the steel on time. We established a base schedule prior to stand down, so we have something to compare to. So when people and contractor and CM says we're delayed, we can compare their base schedule to the new schedule and assess the impact in a much better educated way. We had a significant scope reduction in the project that are under construction, so we can align our needs with the future demand. So we were building Terminal E with 7 additional gates, and we decided to only build it with phase 1 with 4 gates and defer 3 gates because international traffic and the need has diminished significantly. So that's one of the scope reduction. We are working with FEMA on some reimbursement of the cost. We asked all our CM to reduce their staff based on the scope. If we deleted scope, they need to delete CM personnel. And we actually changed all night work in the roadways and on our airport from night work to day work, because honestly, there's no cars on the airport in April, May, and June. Now it's picking up a little bit, but in those 3 months, we were able to do a lot of work on the airport. The airport became almost a construction zone everywhere you went, to be able to get some of the work without impacting passengers. Next slide. We also were thinking about, okay, so, passengers are gonna come back. When they come back, how we can give them a level of assurance or comfort that they can fly, they can come back to the airport. Obviously, cleanliness was one of the biggest things. They wanted to see people cleaning spaces with their own eyes, so we increased a lot of the cleaning, visual cleaning and visible cleaning, not just at night, even though at night we were doing significant amount of cleaning. We also did looked at all the touch point, security checkpoint, the hold room, the check-in hall, the baggage claim. We're working with our automatic screening lane vendor, vendor Landy, to put plexiglass where the passenger divest, also to put UVC for the tubs that's coming back under the system. We have a system that takes the check-in trays and bring it back to the divesting area. And those systems, if we put UV light, we can clean up those trays without using any disinfection. Next slide. We also worked with the airlines and we did a holistic system for social distancing in the hold room. You can see these are true pictures from the hold room. So we had banners that we wrapped around the seats that says basically practice social distancing. So we separated seats, so you cannot sit on the seats that has the blue banners. Rather than put an X on the seats or put something on the back of the seat, we felt that the banners actually blocking the seats are much more useful and much more effective. But we also did, as you can see, the yellow banners that says family seating. So if you are flying with your family, you can sit together in those 3 or 4 seats that are marked for family seatings. We did that across the entire airport. It was consistent effort, so we don't have the airlines, each one doing their own thing. We did it ourselves, and it was well received. Next slide. At the baggage claim, again, we put some marking on the floor to allow people to social distance. And we were worried in the beginning that people not gonna use them or they're not gonna adhere to the instruction. But as you can see in the slide, in the picture to the right, actually people were very appreciative that they had a direction to what to do, and they were using it. We did one test on one carousel in American Airlines, and after that we implemented everywhere on the airport. Next slide. So where do we go from here? We've done a lot on the short term. Our air traffic forecast depend, you got worst case scenario and you got most likely scenario. If you go with the worst case scenario in fiscal year 21, by basically end of June next year, we'll have about 12.8 million passengers. most likely scenario, 21.7 million passengers. Remember the year before we had 42 million passengers. So you can see the amount of impact on the passengers. And the minute you have that impact on passengers, all your businesses are impacted because it depends on passengers. Next slide. So I will leave you with some questions that we're struggling with. So we know that, you know, in 2 years, maybe 2.5 years, we probably will recover back to pre-COVID passenger volume, maybe 3 years, depending on how quick the vaccine will work. But when we go back to pre-COVID passenger volumes, there's some questions that need to be addressed because will and when the passenger will feel comfortable to use public transportation to and from the airport. We had, before COVID, Logan Express was busting out of the seams, Silver Line. We wanted to add more buses. The Blue Line was getting a good amount of passenger going through it. We had several initiatives to add floors on Framingham Logan Express. We had initiative for a suburban additional Logan Express because we wanted to take people out of their cars and put them in public transportation so we can reduce the impact of the cars on the airport because, as you know, traffic was horrible. But even when the passenger comes back, are these people gonna go back to public transportation the way they were before, or are they going to just use their cars and have more comfortable level of driving themselves to the airport? Will they be comfortable to use Uber and Lyft to and from the airport? Or again, you know, Uber and Lyft are used by other passengers, so is people gonna feel comfortable getting into the car that somebody else was in there and they don't know if they were infected or not? That's all going to be a question that we need to monitor and really understand the impact on our roadways. And if truly the cars, private cars, gonna go up, then what does that do to the roadways and the gateways of Logan? Because again, we were trying to take those cars off the roadways and put them in public transportation. But if people are driving to the airport and parking, how is the demand to the parking will be impacted in the future? And these are not today, not tomorrow, but probably 2 years from now. And between now and then, we better figure out the answer to those questions, or we're gonna be in a situation that we're gonna be behind the 8 ball again, and we will not be able to plan better. So I think the one thing I would say, next slide, the one thing I would say is that we have to take this crisis and really try to use it to better manage what we didn't manage, if you will, before the crisis. Manage it better so we are moving forward in the right direction to in the transportation business. So thank you, and we'll, I think, wait till the end for questions.
Thank you, Sam, for your informative remarks and for providing a safe, healthy, and secure environment for the workers and passengers at the airport. You certainly have been productive at Massport, and I look forward to further discussion regarding the impact of COVID during our Q&A session. By the way, great Darwin quote. I'm delighted to introduce our next speaker, Erik Stoothoff, PE. Erik is also a very accomplished Husky, having received his bachelor's degree in civil engineering from Northeastern University. He is a professional engineer in Massachusetts and a valued member of Northeastern's Industrial Advisory Board. Erik is chief engineer for the Massachusetts Bay Transportation Authority. As the chief engineer, he is responsible for all standards for design and engineering and maintenance management for the MBTA. Additionally, he oversees all vehicle procurements, infrastructure planning initiatives, asset management, and quality management functions. Erik joined the MBTA in 2013 in a senior leadership role within design and construction and was responsible for the day-to-day leadership of capital construction and design projects. In the spring of 2016, Erik became the Deputy Chief Operating Officer for Infrastructure, responsible for leading the 850 personnel and 160 million annual operating capital budget that makes up the 5 divisions of engineering and maintenance. In mid-2018, Erik was named as the chief engineer to build a new department of approximately 100 professionals within the MBTA, and for the first time will be independent of maintenance and construction activities to modernize engineering and maintenance standards based on the internal operational and customer experience needs of the authority. His duties also include the leadership of the vehicle engineering team, who are responsible for a $1 billion procurement program of revenue vehicles. Besides being a very active member of our IAB, Erik has served on the board of directors of ACEC Mass in various leadership positions. Without further ado, it is my pleasure to introduce Erik Stoothoff. Erik?
Thank you, Christine, for the very kind introduction. Let's see, David, please bring up the slides. So, all right, next slide. We've got the introduction for me. Real quickly, here is, as of a week and a half ago, the state of Massachusetts, and you'll see in the bottom right of your screen the trend of MBTA impacts, and you'll see it follows pretty closely the trajectory and the peak as it was described in mid-April that we were all managing around. And you'll see that we've also within the MBTA and our personnel have seen a drop off in our active COVID cases, and we feel like we've been able to weather at least the initial COVID spike fairly well. We're fairly proud of the work that we've been doing over the start and run of the pandemic so far in terms of protecting our employees and doing what we can to protect our passengers and maintain service along the vital network that moves much of the day-to-day passengers going to and from work, even though that we're seeing a significant downtrend in that ridership. Next slide, please, David. So here's a chart through the pandemic, really what we saw after the state of emergency was declared, and you'll see our trending of service across percentage. Now it's a little bit of a funny graph where you see the peaks and the valleys on really what are the weekends for our bus service and our commuter rail and particularly the ride service, where it's based on a percentage. So with fewer vehicles operating, but really a fairly consistent percent of ridership going down. It's affecting the graph a little bit, but I think you get the point that we had a precipitous drop off right as the state of emergency was declared. We stayed fairly low in our bus and our paratransit operation at about 20% of normal ridership. And on our rapid transit network, which we call the red, blue, orange, and green lines, we were down around 10% of normal ridership, and our silver line and commuter rail were very low at below 10%. And commuter rail was really down near like the 2% range for most of the peak of the pandemic, and just starting to come back a little bit now, creeping up towards that 10% ridership number. Next slide, please, David. Just to drill into our rapid transit network a little bit, where we saw the most resilience in our ridership numbers was on the blue line. I think serving many of the communities where we had essential workers coming in and out of Boston every single day to provide some of the services that kept the city of Boston running through the pandemic. Next slide, please, David. So while the pandemic rolled out within the MBTA, we quickly shifted much of our focus across the organization to manage to the data that we were receiving every single day from the state and from our own numbers for checking our ridership and our health stats. And we created 5 core groups that were focused on the areas of PPE, cleaning and decontamination, communication, service planning and operations, and policy workforce. Very quickly, we pulled everybody together and really allocated subject matter experts across the agency, no matter what their day job was, where they had certain subject matter expertise. We applied that to these 5 functional areas and started thinking about how are we going to keep running service? How are we going to make sure that the buses show up? What are the bus timings? What are the train timings? How are we going to keep all these services clean and make sure that we provide the safest, most reliable service that we can throughout the pandemic? And then how are we going to communicate this to the public, to our employees, to our family members, and make sure that all across the agency, all across the state, everybody was on board with what our plan was and had an ownership stake in where we were going with managing the pandemic, including all of the union leadership. We really had a great collaboration across the organization with good ideas going back and forth and really trying to manage the best we can in order to keep everyone safe. And it really did work quite well. We like everyone, we had struggles with PPE, with cleaning, with service providers, and so we thought really long and hard about some of the strategies that we would implement in order to bring ourselves to a state where we could protect our employees. I think the last piece of PPE that we got to was face coverings, and we rolled out processes by which we would reuse and help the employees to self-decontaminate and reuse disposable face coverings until we were able to secure enough supply to distribute. We started our own bottling plant for hand sanitizer that we would buy in bulk and distribute to our workforce in essentially little Elmer's glue bottles that we filled with bulk orders of hand sanitizer. And then you see dashboards on the right-hand side of our screen here that through really the peak and once we got into phase 3, we cut back on some of the distribution of data, but we were managing to the numbers every single day. And you'll see in something you can't read, but in the green text on the screen, you'll see those were daily updates on one of the 5 different working groups as we managed the pandemic. Next slide, please, David. So some of the things that we were doing for protecting our workforce and our employees were we quickly ramped up additional cleaning. We wrote change orders to our cleaning and contracts. And we added contractors. We went into a program that you'll see in the center or the center left photos, where anytime there was a confirmed case of a rider or an operator for one of our vehicles, we would decommission that vehicle for a period of time until we could go through a program where we would fog with a decontamination material to kill the COVID virus and make sure that it was safe for our workers to access those vehicles for maintenance or for operation. And then we would wipe down all the high touch points every single day, multiple times a day when we pull back. And then the fogging operation also still carries out, and these protocols still carry out today prior to every service day and every service shift, the wipe downs and then the fogging every time any vehicle goes into what we call the work row, or basically once a week when they go back into the maintenance bay for some of their systematic checks. And then obviously if there's any unplanned maintenance, they go through the decontamination before they go into the maintenance shop. Next slide, please, David. Continuity of operations was big right out of the gate. We very quickly shifted our operation to bifurcating our teams into Team 1 and Team 2, where essentially we took the entire organization that runs the MBTA and we separated every employee into either Team 1 or Team 2. And then never shall Team 1 and Team 2 cross-contaminate one another, and so there were discrete handoffs between those different teams for service. So in the most critical location, our operations control center, which is the photo you see in the center, we would have a Team 1 that would work the first shift at the operations control center, and then Team 2 would work out of the backup operations control center. And while that operation was going on, we were cleaning and decontaminating the alternate control center. We were Also doing that with our maintenance staff. One of the biggest areas we were concerned about was the maintenance staff that performs the inspections and preventative maintenance of our vehicles and of our physical infrastructure to ensure that those were ready for service every single day. We separated those teams and we delineated crews that could work together and crews that wouldn't work together in order to make sure that we had continuity of operations in the event that there could have been a mass run of infections throughout the authority. We did not end up seeing that, and I think along a big piece of our success through the peak of the pandemic through April was that we were very diligent about our cleaning and decontamination efforts, and the physical distancing that we implemented through the Team 1 and Team 2 operation predated any really social distancing activities, but really set us up for success throughout the peak of the pandemic. Next slide, please. Throughout all of this, you'll see on our system, if you haven't already been through it, but communication is always key, and we kept pushing public messaging to our passengers, to our employees, that social distancing, face coverings, hand sanitizers, hand washing, all of the good practices that we've all been talking about for the last 6 months or so is continued to be pushed by the MBTA as part of our public service to our customers, to our employees. And we went through a pilot program where we handed out hand sanitizer and face coverings. And in the event an individual feels that they're on our system and is uncomfortable because they don't have a face covering, we are in the position where we now can provide that to a passenger. Next slide, please. In addition, we were pushing out information through social media and developing apps for tracking our vehicles, particularly our buses, for on-time performance and what the crowding levels of our buses are, where our dispatch was in constant communication with our operators to understand what the level of crowding on our vehicles were, so that they could push out information like what you see on the right-hand side for our crowding data, so that we could push that information to our customers, because really safety is first. I think everybody is very, very well aware that they need to get to their jobs, but we wanted to give everybody the greatest information they could when accessing the public transit system. And if that means waiting 5 or 10 minutes for the next service vehicle to get your ride because of crowding concerns, then we wanted to make sure that people had the most information we could give them. Next slide, please. So part of our challenge with the capital works, similar to what Sam was talking about, but a little differently in that we are a fixed route system, and there is so much infrastructure back of house operation that goes on. Is we were very challenged in the beginning to figure out how we could provide the service, promote the social distancing, create the continuity of operations, and progress through some of the capital works that really made a lot of sense with the low ridership that we had. And the way we got to that place was we figured out how we could do surges. And what the surges are essentially shutting down sections of the lines that where we could perform some really targeted construction activity and make headway against our state of good repair goals and targets while we were able to continue that social distancing. And so here's a list of some of the surges that we've had to date, and we're continuing to think about additional locations. Next slide, please. So the next few slides are a few examples of what we did to promote the surges and the state of good repair construction, particularly on our Blue Line. This was our highest priority because the Blue Line ridership was still seeing heavy ridership, but we could handle it with a bus diversion, and we could handle the 100 buses that it would take to run continuously to provide the service along the route of the Blue Line. Plus, as you can see from this photo in the center, it is a very constrained construction activity area where really we need diversions like a weekend or a week-long, 10-day-long diversion as we enacted upon in order to do some of the real critical state of good repair construction activities we needed. In fact, we were able to perform work that removed a 1.5 minute speed restriction off our system because it was just an impossibility from an operating point of view to take the tracks out of service for the amount of time it took to perform some of this track reconstruction in a very constrained 100-year-old tunnel that connects the Blue Line from one side of Boston over to the Logan Airport side of Boston underneath the harbor. Next slide, please. So in addition to performing track work, we took advantage of the same time and we really hit all disciplines that work in here. We did cable renewals on the power system. We did crack injection to prevent leaks and concrete repairs to the tunnel liner. We built new truck pads in order to provide easier access to the construction equipment for easier on and off during this period of time. Next slide, please, Dan. And then in addition to which, we did fire life safety improvements along the stretch, and we replaced the entire standpipe from one end of the tunnel to the other end of the tunnel, and we're able to take advantage of not only hard transportation services, but fire life safety and really improving the safety condition of our infrastructure while we had the tunnel shut down. And really, these activities were carried out in all of those surges that I listed earlier in the presentation. Next slide. As part of our constant communication with the public, we implemented the Ride Safer program, where we talk through with the public what is safe, what is not safe, what are the facts, where can I get information about the MBTA. So mbta.com Ride Safer, hopefully you've seen the signs and you can go there and you can get your information. And we are taking all of these calls seriously. Safety obviously is number one at the MBTA, and that includes some of the softer side of safety, which is the public calling in and being concerned about ridership concerns or crowding concerns and cleaning concerns, and really trying to address the needs of the public as we provide this critical service. To Sam's point, how do we make sure that the public is comfortable coming back to Boston, riding the public transit system to and from their workplace, to and from the airport, to and from restaurants or social gatherings when life comes back to normal. Next slide. And then just to wrap up my piece of the presentation here is planning for the new normal. Similar to Sam, we have questions as to where and when are we going to return to a state of normal. I think we're in a state of normal right now, at least for the short run, probably another year or so, and we're planning for that. We are maintaining safety. That is number one. So safety means that we are going to be continuing to clean and decontaminate our system the way we are today. We are preserving service. So we are looking at our capital program, and we are looking at those initiatives that are absolute musts in terms of maintaining the safety and the service of our system. And then we are trying to think about some of the nice to have improvements and maybe lowering those along the priority list. And if we're going to do it for one, we're going to do it for all. We're going to be equitable in the way that we implement our changes in our service and in our capital program across the network that is the MBTA. And then we're going to plan for sustainability. We're going to think about COVID in the future. We're going to think about not only resiliency as it pertains to environmental, sustainability and reliance, but also how do we make decisions that envisions a network where COVID and COVID-like events are a reality. And then we're going to base those decisions on the data that we have. And we're going to be very thoughtful about how we manage some of the fiscal crisis that we're all looking at, and how we manage the ability that we know that we're going to be part of the recovery. We know that the MBTA is important for the city of Boston and the region to be successful and to continue to be successful, for all the institutions like Northeastern and all the businesses that many of us work at, coming to and from. And what is the daily commute look like? How many people are coming back to the city for work and reverse commuting? So those are some of the things that we're thinking about right now. We're looking at how we can continue to enhance modifications to our vehicles, our filtration systems, our decontamination systems, our cleaning contracts, and making sure that everyone feels comfortable riding the MBTA in the future. Thank you. Christine, I'll hand it back to you.
Thank you, Erik, for sharing your knowledge and expertise with us today on COVID impacts of the MBTA. Again, very informative. And like Massport, top-notch leadership and good communication skills have been key to moving forward towards a new normal. We very much appreciate all the work you do to help protect workers and customers. Our final speaker is Dr. Stephen Flynn, who is founding director of the Global Resilience Institute at Northeastern University, where he leads a major university-wide research initiative to inform and advance societal resilience in the face of growing human-made and naturally occurring turbulence. Dr. Flynn is a professor of political science with affiliated faculty appointments in the College of Engineering and the School of Public Policy and Urban Affairs at Northeastern. Professor Flynn has previously served as president of the Center for National Policy and spent a decade as a senior fellow for national security studies at the Council of Foreign Relations. In 2008, Steve served as the lead Homeland Security Policy Advisor for the Presidential Transition Team for President Barack Obama. Dr. Flynn was an active duty commissioned officer in the U.S. Coast Guard for 20 years, including 2 tours as commanding officer at sea. He is the author of numerous textbooks on resilience. He was appointed by the Secretary of Homeland Security to serve as a member of the Homeland Security Science and Technology Advisory Council, and also serves as chair of the Massachusetts Port Authority's Security Advisory Committee. Professor Flynn holds MALD and PhD degrees from the Fletcher School of Law and Diplomacy at Tufts University and a BS from the U.S. Coast Guard Academy. Steve's representative listing of national professional awards and accolades include an honorary Doctor of Law from Monmouth University, Northeast University's Outstanding Innovation Award, and the U.S. Coast Guard's Commendation Medal and Achievement Medal. I am now proud to introduce our final panelist, Dr. Flynn. Steve?
Thanks so much, Christine. And I'm just going to really try to provide just maybe a few helpful remarks to build on what both Erik and Sam have laid out for us here. They're the real reasons why you should be here. Folks who are truly on the front lines and providing the leadership in managing this challenge. I'll say at the outset, I think what we just heard from Erik and Sam is precisely the kinds of things that are key to leadership generally, but especially in crisis, which is the need to think forward and to anticipate and confront the trade-offs that you're going to be facing. And a corollary to that is that, quoting David Peltiel, the Yale School of Public Health, you should not assume everything that could go wrong goes right. So the key here really is dealing with the reality, but looking ahead and then figuring out how to map it and making the hard decisions about the choices that we make. What I just want to highlight, because it's core to the resilience imperative, is that when we look at any sector like transportation, we really are, though, of course, looking at a system within a number of systems. I've had the privilege over the last 4 months to work on to lead a team on a major effort to support FEMA Region 1, which is covering the New England region, to do a needs, to help each of the 6 New England states do a needs assessment about what they need to address in order to have a resilient economic recovery, ideally so they could bounce forward instead of bounce back. And those assessments bring some very grim findings, and are likely to get grimmer, and they would clearly impact on the transport sector. And I'm just going to highlight one of them, and it is that one of the impacts is a dramatic one on, of course, with rising unemployment, the number of people who rent homes or who own homes who are likely to find themselves in either eviction or foreclosure. You can start to imagine how this starts to ripple effect on the municipalities that are dependent on property taxes as a basis for income. In addition, as we reduce all our activity, the fees that municipal governments rely on to provide operations is impacted. And if we add that in many communities, 80 to 90% of their budgets are fixed to pay for things like pensions and salaries and contracts, the operating budget that they have, the discretionary budget to provide critical services, there's not a whole lot of wiggle room there, especially if state revenues and the sharing that they provide from things like sales tax and so forth aren't available. So what we're confronting here is that the revenue stream that supports critical infrastructure, especially one as dependent on public financing as transportation, is going to clearly be under stress for a substantial period of time, absent significant federal investment to try to hopefully prop up to some extent to the economy can recover state and municipal governments. So that's pretty grim, but I want to finish with an optimistic note. Right? Sam already referred to this. A crisis is a terrible thing to waste. It's an axiom at the Global Resilience Institute. Never let a disaster go to waste. And what we're really looking at here, though, in this instance, is a potential to rethink and reimagine what our transportation infrastructure should look like in the post-COVID environment, where there may actually be a fresh opportunity on revenue. There really are three sources right now. One is actually recovery funding that is available and out there, and looking and leveraging that in order to support capital projects is something that the states are starting to really step on. And there's a fairly significant amount of resources available, and either grants or loans or those kinds of things. So that's an opportunity for money that wouldn't be available, but is available because we're in a disaster setting. The second is probably almost certainly after this election, there will be a major focus on infrastructure. We've been delaying this for like decades. It's going to be critical to restarting the economy. And there's almost a certainty, therefore, that there will be more resources potentially directed at major infrastructure. Third, and I think it's important, there's a lot of capital that's sitting on the sidelines in this current environment, and private-public partnerships, which have not got a lot of, let's say, affection in the US context, are going to be clear if we're going to access those resources. Is it the wallet in the public is not unlimited, and thinking through public-private is key. In the case of, though, of all three of these funds, recovery funds, potential infrastructure plus up as a federal initiative to stimulate the economy, and public-private, the advantage will go through those who have plans, shovel-ready plans ideally, who are thinking forward, who have analyzed the trade-offs, and are making persuasive arguments why both the government and why the market and ultimately the public should invest in those plans. And I think we have that kind of leadership clearly with the at Massport and the MBTA, and I'm hopeful that the Commonwealth can do good in this turbulent environment. So I'm going to stop there.
Thank you, Dr. Flynn, for your valued insight on this important topic. I want to be respectful of time and open questions up to the audience. So I'm now turning this panel session back to our esteemed department chair, who will coordinate and control the audience questions via the chat window. Jerry?
Thank you very much. We have just a few minutes here. Maybe we'll go slightly over time. We have some good questions in the chat. Let me start, and this could be a question for all of you. Perhaps from one of our alumni in Dallas, who says Dallas area rapid transit has been trying to answer the question of when riders are going to comfortably come back, combined with what percentage of downtown staff might be expected to continue to work from home. Are you folks looking at some simulations or planning models that are thinking about how the future might lay out relative, for example, to MBTA ridership or to Logan?
So Jerry, I think it's still early days on that kind of modeling. We are talking with business groups like A Better City and others across the city of Boston for what they're doing with some of their questions with business. I mean, I think it's fairly clear, at least to us at the T, that this experiment that we're doing right now with having a conference on Zoom is something that is not really hindering productivity for office staff very, very much in the current environment. And so I think we're expecting that there is going to be a significant dip for a while in regular commute from the suburbs into the downtown business district. What that looks like, how much that is, and when that may peak back up, I think there's a lot of differing opinions on it. And I think there is something to do with the rebounding that we're seeing right now socially across the country with some of the peaks and spikes in cases, because people crave that social interaction. That is going to drive actually some folks to come back into the office to work in that business environment. So we are optimistic that there will be a return to ridership, but the exact numbers, I think right now we just know it's going to be lower than it was pre-COVID. And we're trying to understand with the best information we can get at the time. And just right now, we're a little on the early side, I think.
Good, thank you. Let me go to another question. What's your best guesstimate of the % change impact on the capital program over the next 2 to 3 years? Have you started doing projections on that, or also still too early? Sam, maybe you could take that one.
Yeah, like I said, we had dropped our capital program about 1/3 for the next 5 years, but that's considering that we will be recovering in the most likely scenario. If things keep going down the way we're seeing it, and the vaccine doesn't come in the way that people are expecting, I think it could go down to a lot more than a third drop in the capital program. So I believe that the one thing that Steve had mentioned that will help is the federal government with a lot of grants to stimulate the infrastructure of the country. So that may be a savior for a lot of the capital programs for airports and for transit authorities. So we just want to watch what the federal government would do in supporting the infrastructure of the country and how they're gonna, invest some money into it to get everybody back to work.
Jerry, if I could maybe just highlight one,
Yes.
really challenging issue, especially for Metro Boston, and one is very close to our home at Northeastern. But there are 52 colleges and universities and institutions of higher education in Metro Boston, about 340,000 students. And what we know is a major driver to the economy, and we obviously have all the faculty and staff. A lot of our tourism is tied to the universities, parents flying in and out to look at schools and with their children and so forth, alumni event, homecoming events. This is going to be a very challenging year for higher education. And so the impact for all the small businesses, for the restaurants, for the cultural sites, higher education is a true anchor for the region, a driver for a lot of what's going on in transportation, transit, both the airport and the mass transit system. So that's going to be a challenge. That's going to, one sector, again, very much impacting on other sectors, which is a story of resilience challenges.
Absolutely. Well, I think we'll need to wrap it up there. And I would like to thank our moderator and all of our speakers and to our audience for the great questions. There were several more questions in the chat. I'm sorry we didn't get to those. These are certainly challenging times, but very heartened to see the hard work in the civil and environmental engineering community to study and develop solutions for these issues. And certainly moving forward, we'll be continuing to do that. So in closing, I'd like to thank you all for joining today. I'd especially like to thank all of you out there who are alumni from our program or who are students. Thank you so much for joining us. Please join us also for our next and final panel discussion, Environmental Health in a Pandemic, on August 12th at 12 noon. We hope to see you there. Goodbye, everybody.